Over the years here at Montgomery Heart Wellness, we've treated many patients with chronic illnesses, most of whom have cardiovascular disease. However, because of the nature of what we do, we've seen many individuals who've come to us with many other chronic illnesses, inflammatory conditions, metabolic conditions. And among those other conditions, we often see patients who have advanced cancer come to our center asking for help. Today, we're going to discuss a case of a man, 62 years old, who's diagnosed with melanoma with evidence of metastasis to the lymph nodes and to the lung. The patient was very distraught upon his initial arrival. In fact, he was more concerned about the treatment alternatives for his cancer than he was about the cancer itself. Hence, our job was really cut out for us. Welcome to Montgomery Heart Wellness for another session of Clinical Rounds. Today we're going to discuss Mr. MT, who's a 62-year-old man with melanoma. So tell us about that, Camille.
So yes, he was diagnosed with melanoma in October of 2022, and he had the primary lesion removed surgically, but they did find some lymph node involvement. And that was in January of 2023. And so the lymph node involvement was very concerning to him. They recommended a low or moderate dose of immunotherapy, but he had done a lot of research and heard a lot of things that were scary to him about immunotherapy, that harming other tissues in the body and requiring patients being treated intensely for new health issues because of that. And that was one of his main fears and concerns, was what can I do in this situation? How can I learn more about what I have control of, and what route should I take?
There were 3 treatment regimens, and there was a low dose, a medium, and a high dose. And the high dose immunotherapy regimen, if I recall, had about a 55% chance of multi-organ dysfunction. You know, it could take out the thyroid gland, you remember him saying, the GI tract, the liver, particularly kidney failure. The intermediate dose, I believe, was maybe more like 20-25. And then the low dose is about, say, 12 to 15% chance of a problem. But of course, all of that made him nervous. Now, 12 to 15% chance is quite high, in my opinion, of having multi-organ dysfunction. And it was kind of interesting. He was more afraid of the therapy than the actual cancer itself. What symptoms did he have, or what was going on with him clinically when he presented?
Well, he could sometimes feel pressure with the axillary lymph node, but it wasn't constantly painful. He didn't have fatigue, muscle pain, joint pain, weakness. He didn't get, the chills or sweats. He didn't have a lot of these systemic symptoms of severe illness that we see a lot of cancer patients have.
So he's actually feeling relatively well, from what I recall. It was interesting because, here you have a diagnosis and there's a recommended treatment that has a pretty reasonable chance of making you feel sick, when in fact you're not very sick, but you do have an underlying life-threatening illness. So I can see how that's a very, very challenging dilemma, in the sense that, okay, what am I going to do? I'm not sick right now. Do I take this therapy that's supposed to cure me but make me sick? But I'm not sure it's going to cure me. There's a chance it's going to make me really sick. It's not 100% chance it's going to really cure me. I remember when he came to the office and I went to the exam room and I said, well, what brings you here today? He said, I've got melanoma. And I smiled and said, you realize we're a cardiology practice.
Yeah.
And so we're frequently asked to see patients with chronic illnesses, and it's written in my book, The Food Prescription for Better Health, that these illnesses all have one common source, one common denominator. So we see patients with a lot of chronic illnesses, who do not have cardiovascular disease or have chronic illnesses in addition to cardiovascular disease. And, we've seen how their bodies can turn around in different ways. And so he presented a special challenge because he had advanced cancer. He was trying to make a decision whether or not to go through with the immunotherapy or the cancer therapy, or go with a natural approach. Now, my thinking and the explanation to him is that, one, you didn't have to make an absolute decision right now. You always want to do things to improve your health. So that's the easy first step. You always want to have a natural, healthy diet. And our definition of that is a natural, minimally processed, plant-based diet. You want to do things to enhance your body's liver function, kidney function. So you want to be hydrated, obviously well rested. And also one thing that we do here, recommend patients do, is to minimize the number of prescription medications that you're taking. Now that seems like a trivial thing, but if you have to take chemotherapy, these drugs are pretty toxic or potentially toxic, and they have, a stressful effect on the liver and the kidneys. If you get a diagnosis of cancer, the three most important things I recommend our patients do. One, immediately start on a nutritionally optimal diet to boost your immune system, cleanse your organs, cleanse your tissue, etc. Number two, you want to hydrate, get proper rest, those type of things. So those other healthy lifestyle habits, you want to start to exercise. And number three, you want to minimize prescription drugs, anything that puts stress on the liver and the kidney as much as possible. That was the initial thing we looked at with him and wanted to make sure we started with. And he had already started making changes in his diet and so on. So that was good news. Probably was why he was feeling as well as he felt. So.
Right. He wasn't on any prescription medications to begin with, so.
Yeah. So a lot of our job is already done. So now we have this patient here. He comes to you, says, "What should I do, Camille? I want to do something natural. I don't want to take this." What do you tell him?
I just always tell patients in that situation that we can help them to make their own immune system stronger, to do a better job of itself, to fighting the damaging cells in the body and helping the good cells do their job better. And so definitely making sure they're getting all their vitamins and minerals in their diet. Maybe we add superfoods, add anti-inflammatory supplements or infusions to strengthen the own body's ability to heal. And ultimately it's the patient's choice what they want to do with a traditional treatment regimen. A lot of our patients might do traditional regimens and a lot of the natural things, and that can really lower their risk of all the adverse effects from traditional therapies and do really well. He was really concerned too with the lungs, because he had an initial CT in February with no lung involvement and a CT in May that showed 5 new lung nodules, and of course he got a lot more pressure from the oncologist to do that immunotherapy, and that was a very stressful time for him.
As you laid out the course of events, 6 months prior he had the diagnosis or longer, biopsy positive, then it was removed. 2 out of 5 lymph nodes were positive. That was December. They had removed the primary and 2 out of 5 nodes were there. A CT scan and MRI of the chest showed no metastasis. So the recommendation at that time for immunotherapy was prevention. And they said, okay, let's go with the low dose. Then he started in the axillary area. Now he'd already changed his diet. He was exercising, doing things, a lot of things we recommend. But between that February and I think it was May, then they discovered metastasis to the lung. What was very suspicious of metastasis to the lung. So he came to us shortly after that. And at that time, when they saw those changes on the CT scan, they said, look, we've got to do this now.
Right.
because this can get out of hand. And so he was really nervous, really distraught. It's a tricky situation because you have somebody with a cancer that's potentially getting out of hand. So the cancer is metastasized and the cancer's on the move. The therapy was more intimidating to the patient than the cancer was, which I thought was quite interesting. So with that, we had a difficult task. We don't treat cancer. In fact, I argue with our patients, we don't treat cancer, we don't treat heart disease. We actually enhance our patient's ability to heal itself. If it's heart disease, reverse that. If it's diabetes, reverse it. If it's cancer, fight the cancer. And I think that's an important concept for people to understand. The nature of what we do and the integrative, natural approach is to enhance the body's ability to heal itself, which I think is really important. What do we recommend up front for him?
Doing the raw plant-based with intermittent fasting. We recommended the EBU, a form of ozone infusion therapy. We recommended the Myers infusion, so vitamin C and some other vitamins as well. And we recommended another antioxidant called poly-MVA, which has alpha-lipoic acid in it with some other vitamins and minerals. And all of that really just helps circulation, helps your immune system have more function in the mitochondria of all of its cells, helps your body to reduce inflammation in the nerves, the muscles, the heart, liver, kidneys, everywhere. So beneficial in just having cancer and beneficial if you're to get traditional therapies.
So let's break these down. So let's talk to our audience about high-dose ozone. We call it EBOO. That's EBOO, capital EBOO. Stands for extracorporeal blood oxygenation ozonation. What does that do for the body?
So that EBOO therapy helps to increase oxygen uptake in the tissues. It helps increase mitochondrial function, so like energy production in the cells. That's makes every cell do its own job better. It increases nitric oxide production, which helps keep blood vessels open, maintain good circulation. It can help with stem cell production, so it essentially modulates your immune system to do a better job to shift from inflammation and disease progression and instead shift to cell repair or disease reversal.
We're enhancing the body's cellular function, enhancing the body's ability to fight cancer in this situation. Other situations may be to reverse heart disease, etc. And modulation of the immune system, in this situation, you enhance the immune system's ability to fight, because the immune system has to fight. In other situations where the immune system is fighting too much, like autoimmune, you're calming it down. So modulation is making the immune system just right. How about vitamin C?
So that's a big antioxidant. We all know about that one. That helps your blood vessels. That helps reduce damage from free radicals. And free radicals are created from what we eat, environmental pollutions. Cancer cells cause damage. So antioxidants help prevent damage by these free radicals everywhere in the body. And vitamin C is just one that we utilize with IV infusions.
The last one we talked about is poly-MVA.
That's a molecule called alpha-lipoic acid bound to other vitamins and minerals. So alpha-lipoic acid actually plays a role in enhancing other antioxidants like vitamin C, like glutathione. And because it's also bound to other vitamins and minerals we need, this poly-MVA concoction really helps very systematically in so many disease processes, and you can take it orally or get an IV infusion, but that's a big superstar one, I would say.
So these adjunct therapies are what we started with, and of course superimposed on the raw plant-based diet with time-restricted eating, which is the foundation of the treatment. Does all of these things. It reduces inflammation, reduces oxidative stress. Plant-based diet is very powerful anti-inflammatory properties, antioxidative stress properties. Also, it feeds the microbiome, which enhances the immune system. Plus, fasting allows the body to heal itself. So here we are. We've got a good treatment regimen for him. This is a good place to start with him. We started this regimen, and the future will tell what we see next. So the concern was the metastasis to the lung. So 1, he's going to start the regimen. 2, we need to see how he does on the regimen. 3, he needs to go and do some soul searching and figure out which approach he's going to take.
Right.
And we're going to follow him very closely, be emotionally supportive, which I think is very important, because I think as someone has emotional confidence in terms of being successful, that improves your chances of being successful. And then we'll have to wait and see what the CT scan shows after this.
Yeah.
Stay tuned. Thank you very much for joining us, and stay tuned for the next episode, and we will update you on the progress of Mr. MT. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button